Hello, my name is Avelina. Today I want to talk about the nutrition focused physical exam and why it is important in nutrition assessment. So, the objectives of this video is to understand the purpose of the NFPE and to learn how to utilize the NFPE in dietetics. Also, to learn the different diagnostic criteria for malnutrition. So, malnutrition is defined by the World Health Organization as excessive deficiencies or disbalance in an individual's intake regarding nutrients and energy. So, in general, this is an umbrella term that encompasses undernutrition, such as wasting, stunting, and being underweight, as well as micronutrient malnutrition, important vitamins and minerals, and diet-related diseases that are not contagious, such as obesity, cardiovascular disease, being overweight. All of that is encompassed under the umbrella term of malnutrition. So, the implications of malnutrition tend to be to increase the length of stay, as well as morbidity and healthcare costs and mortality rates, because as the people stay longer, the healthcare costs end up increasing, and as when malnutrition combined with other comorbidities or other disease states can ultimately complicate them even further and increase morbidity and mortality rates. So the most common form of malnourishment tends to be protein energy malnutrition, and as dietetic professionals, we ought to be coming in and treating our patients and being aware and looking out for this particular type of malnutrition. So, diagnosing malnutrition, energy intake needs to be less than 50 to 75% of the estimated energy requirements. Weight loss must be 7.5% or more over 3 months, greater than 10% over 6 months, or greater than 20% over a year. So the patients also must exhibit loss of fat, muscle, and increased fluid retention, as well as reduced hand grip strength. We as professionals, we should take a look at reduced hand grip strength because that can actually give us information on the strength of the patient. That can be even as simple as coming into the room and giving the patient a handshake when introducing yourself to the patient. And that can already give you an indication of the nutrition status of the patient. So, as mentioned, further malnutrition can further existing issues and complicate the healing process for patients even further. So, it is important to detect malnutrition prior to further damage being done. So, what is NFPE? It is a physical exam used to assess the nutrition status of a patient, particularly for malnourishment. So, it is a subjective method of screening because it is used. The dietitian, the professional, is supposed to use clinical judgment when doing this assessment. So, it must be combined with other findings in order to determine the nutritional status of the patient. So, the focus of the NFPE includes muscle, subcutaneous fat, fluid accumulation, and the reduced hand grip, as mentioned before. So subcutaneous fat can actually be observed within the orbital area of the person, the fat pads, and if there are any hollow depressions, then that is a sign of malnutrition. Triceps and biceps should be as well looked over because if the skin is pinched and it's super thin, that could be a sign of malnutrition. The thoracic area, including the ribs and the mid-axillary line, also can have depressions in, which could be a sign of malnutrition. So what is exactly the muscle loss that we're looking at? It would be at the temples, and we would be looking for any scooped or depressions, as well as the clavicle. If the clavicle bone is protruding, then that is a sign of malnutrition. And if the shoulder bone or the acromion is protruding as well, that is a sign of malnutrition because there is no muscle mass there or little muscle mass. And we also would then take a look in the back at the scapula for any depressions between the scapula and the ribs. And if so, that's also a sign of malnutrition. Another important muscle would be the interosseous muscle. So this muscle is actually between the pointer finger and the thumb, and if there is a hollow depression in there as well, then that is a sign of muscle mass loss. And so what you could typically do is ask the patient to move the pointer finger and the thumb to see if there is actually a depression. So then we would move down to the lower extremities, and we would take a look at the inner thigh to make sure that the muscle hasn't reduced, and that there isn't a inward protrusion of the bone, of the muscle, I apologize. And so if the muscle hasn't sunken in. And then we would take a look at the quadriceps to make sure that the bone isn't protruding or the muscle is visible. And if little muscle is visible, that is a sign of malnutrition. So then we would go down to the ankles and we would check for any pitting edema. So this would technically just mean that you could take your finger and press into the ankles. And if the impression of your finger is there for some time, then that could give you an idea of what stage of edema that person has. So other things to consider for NFPE would be the skin. If we see any signs of pallor, dermatitis, or any unusual skin discolorations, it could be a signs of important deficiencies such as B vitamins, vitamin K, C, or iron, as well as, so the pallor would, if the person is really pale, it could be a sign of iron deficiency. We could then move on to the nails and look for any colonychia, which is when the nails inverted inwards, and that is typically due to iron deficiency. And we could also observe the nails for any other abnormalities as well. And if the hair is dull and it's easily falling out, that could be a sign of protein, iron, or zinc deficiencies, as well as sometimes when the hair is coiled, that could be a sign of deficiency as well. We would then take a look at the lips to see if there's any chylosis, which is the cracking around the lips, and we would look at the tongue to see if anything is abnormally red or if there's any dysgeusia, which typically those come from B vitamin deficiency or zinc deficiency. We would also take a look at the mouth, because sometimes even the teeth could be a good determinant of just in general how nourished the patient is. So the next thing we're going to do is move on to the practical application of NFPE, and we're going to discuss how NFPE can really be used in the field of dietetics when speaking to our patients. Alright, so now I'm going to demonstrate how the nutrition-focused physical exam would be done in a patient's room. So first, prior to walking into the room, you would definitely wash your hands and put on gloves. And then as you come into the room, you would introduce yourself to the patient and explain to the patient what exactly will be going on. So that this would be the demonstration. Hi, my name is Evelina. How are you today, Mr. Jacob?
Doing well.
It's nice to meet you. I'm going to be your registered dietitian for today. Do you mind if I do a nutrition-focused physical exam on you?
Sure.
Alright, so basically what I'm going to be doing is just checking for signs of malnutrition. Is that alright?
Alright.
Okay, perfect. So I'm going to start with the hair. Move to the temple area. Orbital region. Good. Move into the clavicles now. Alrighty, in the chromium section right over here. As well as the scapula. I'm going to check underneath the scapula. Thank you, sir. Alrighty. Now, do you mind lifting your arm for me? I'm going to check the tricep area and pinch the skin. And if the skin feels paper thin, then that is a sign of malnutrition. Alrighty. Now, do you mind pushing against me over here? Alrighty. Alrighty, perfect. Thank you. Now we're going to move to the mid-axillary line and the rib section, as well as behind. Alrighty, looking good. Thank you. Now we're going to move to the lower extremities. Checking the inner thigh. Okay, good. As well as the quadriceps. To see if there's any muscle loss. And then we're going to ask to touch the ankles to see if there's any pitting edema. Alrighty, as well as the hand. And as we shook the hand in the beginning, we would check for the hand grip strength. And then over here, we can check for the interosseous muscle and ask for the patient to move the finger and the pointer finger and the thumb together. If you could do that for me. Alrighty. Got that. Alrighty. And then the following thing I would do as well would be to look at the nails to make sure that there is no calintia, as well as look at the mouth, around the mouth, in the mouth as well, at the tongue, if you could stick that out for me, to make sure that there is no B vitamin deficiency and that the tongue isn't red. So this is how you do a nutrition-focused physical exam, and thank you for watching my video.